Well, good morning. I'm Ed Ullmann, and I'm the pharmacist here at Wellness RX, the beautiful pharmacy located on the mountaintop in Tannersville, New York. Today, we're going to talk about the coronavirus. And as a pharmacist and a trusted health professional in our community, I feel that it's important, and if not my public responsibility, to speak honestly to my patients and to my community on this important public health issue. Today, I not only want to talk to the adults, but I also want to talk to our kids and our young adults, since really we are all in this thing of life together. The coronavirus is serious, and we must be concerned and we must be prepared. But first, let's begin with the facts. Each year, the flu hits hard on a small number of members of our community, and they face symptoms. They get fever, they get chills, they cough, they get GI issues, weakness, dehydration, and overall they just don't feel good. And sometimes a patient will even come down with the flu after they receive their annual flu shot as recommended by the CDC, or the National Center for Disease Control. You know, every year the CDC does its best to try to predict which strands of influenza will hit the United States. They recommend then a blend of strands that is then used by the manufacturers, and oftentimes this is a year in advance, to make up vaccines for the following year. Some years are better than others. It remains an imperfect science. But I truly believe that getting annual flu shots is a great public health benefit to help stop an epidemic in our country. Fortunately, 8 out of 10 flu cases are mild in nature, and patients start to feel better in a week or two. From our experience, when there is intervention with antiviral products like Tamiflu, or elderberry, and some of the ones we'll talk about today, they can reduce that and get back much sooner. And then what we look at is, while 200,000 patients are generally hospitalized for the flu each year, fortunately less than 1% of these patients actually die from the flu. And the majority of the deaths are going to be our very young, our older seniors, and patients who are dealing with serious health challenges, especially COPD. So far, the coronavirus remains an unknown, especially its expansion potential in the United States. Based on reported news, patients with the viral experience will primarily see symptoms of fever and cold and coughing, and sometimes very serious respiratory issues that can lead to pneumonia and death. The good news is that, similar to the regular flu, 8 out of 10 patients are testing positive for the virus are only experiencing mild or no symptoms at all. And no symptoms at all is a key thing that we have to watch. It also appears at this time that our children are at low risk of getting infected by the coronavirus. Now that's good news. Now the key issue for us in the United States will be the number of flu victims that test positive but have no visual signs of an infection. That they're going to test positive, but they will have no visual signs of an infection. Hence, they will be able to continue to spread the virus to others where they work and in their community, and they're never going to know it. And this is what we call one example of what's called community spread or community transmission. In China, where the coronavirus originated from, we have now identified 14 patients out of each 1,000 cases. About 1.4% have died so far from the virus. And this compares to about 0.5 to 1% of flu mortality, or of a flu mortality rate that we experienced last year in the United States. Worldwide, there have now been a reported 9 90,000 cases of coronavirus, and these have been confirmed, and it's resulted in about 3,000 deaths, primarily in China. And as of yesterday, it was reported that there is now 60 cases in the United States that have been identified that have coronavirus. So what can we do to be prepared? And while there is no vaccination to date to deal with the coronavirus, and few individuals, if any, have therefore built up any immunity against the virus, it is still advised to get an annual flu shot. And if you still, at this late date, have not gotten an annual flu shot, and you get one, understand it's going to take you up to 30 days before you will get immunity, and then that immunity will hopefully be strong enough to protect you from the CDC recommended flu strands that we are now dealing with. Second thing we all can do to be prepared is go back to the more important things that you hear as what we might call conventional wisdom. You know, wash your hands for 20 seconds at a time with hot soapy water after you've been exposed potentially to the virus. This could be something as simple as doorknobs, it can be countertops. Use your best judgment. Use hand sanitizer. Try not to touch your face. Try to squeeze when you sneeze, into your arm and not into your hands. So many of the things you've been heard for the regular flu, we want to do for the coronavirus. Now, remember, the most common way that we get the flu or the influenza is from breathing in particles or droplets of airborne fluid. And when one sneezes unprotected, understand that we are contaminating up to 6 feet all around us. It's a pretty big space, and that's why it's so easy for someone to be breathing in the droplets and then they get sick. Understand that all flus and colds are viral in nature, and antibiotics will have no effect on a virus. Therefore, we must combat a viral infection with a strong immune system, antiviral drugs, and antiviral natural products. Our immune system is really magical, and it's designed to produce white blood cells and to attack any germ that enters our body. Hence, it protects us against disease and other potentially damaging foreign bodies that enter into our system. Maintaining a strong immune system is a combination of hydration and diet and stress management and exercise and getting proper rest and also taking supplements. Understanding that 70% of our immune system is contained in our gut or our GI system. We now strongly recommend that both children and adults take a daily probiotic. It's very safe, and a high-quality probiotic will often contain 12 to 15 billion live cultures of bacteria. That's billion of live cultures of bacteria. And then what this does is that as we put in this good bacteria into our gut, it starts to repair the intestinal tract, even when we're not taking an antibiotic or something else that will disrupt it. And hopefully, by maintaining this, we can improve our immune system. Looking out the potential impact of the coronavirus to our communities, we now are strongly recommending that you ask your doctor for a prescription now for Tamiflu, so that you are ready to introduce a strong antiviral medication to your body on the first signs that you see you have a problem that could potentially be flu. For maximum effectiveness, Tamiflu needs to be given within 48 hours after the first sign of a flu infection. If the coronavirus spreads, we can now anticipate there's going to be panic. We know there's going to be long lines throughout our healthcare system and our supply chain. Therefore, in this vein, we also suggest you, in addition to asking the doctor for Tamiflu, that you ask for a 90-day supply of your routine maintenance medications, and you start to stock up on basic supplies and also for canned goods. You know, let's be prepared, let's be a little conservative to be ready. And if we do not have a major problem, then good. But let's be ready and understand we've got to move fast if we ever start to have symptoms of the virus. For daily supplements, we highly recommend natural products that have both antiviral and immune strengthening properties. And we've been working with these products now for 5 years. We have 500 or more of our patients that have taken each one of these products that I'm going to recommend, and we've seen some very good outcomes. Our number one recommendation is mushroom extracts. Now this is one that we use a lot. It's shaga. Reishi is also very good. Mushroom extracts are very safe. They are not only antiviral, they are a strong immune booster. They're anti-inflammatory. Some of them help with detoxification. Some of them help to balance the hormones and the enzymes of our system. But we think that everyone should consider taking a mushroom extract as a prevention. We also strongly recommend elderberry tonic. Elderberry works really fast, tastes good, and it works really fast to boost the immune system, and also it's antiviral. Now, elderberry comes in honey, it can come with a vodka base, it can come in a concentrate so that you can travel. We also highly recommend anyone traveling to take elderberry tonic before you get into a plane or any type of public transportation that's going to be full of germs. And take it before, and take it while you're in transit, and then take it when you get out. So both of them we found are excellent. I like them because they're both safe and effective for children and for adults. We also recommend that you start taking 500 milligrams of vitamin C. It's a very strong antioxidant. And take it throughout the day because it's water soluble, so it will leave your body quickly. And we also, please make sure you stay hydrated during this time. Just four pint bottles of water a day, it will work. Need it. Put water around the house so you remember. But staying hydrated is so critical to be able to starve off infections. And we also suggest you start adding immune boosting and antiviral foods to your diet. Sauerkraut is very good, and garlic is very good in particular. Now, if you or a family member comes down with the flu, it really doesn't matter if it's the coronavirus, because you might not know if you haven't been tested, or if it's a regular flu. Number one, you need to be aggressive. You got time. You got about a 48-hour window. Understand, once that flu and the virus has entered into your system, it is rapidly, by the millions, creating new viruses as we speak. You've got to move quick. Now, what we suggest that you start Tamiflu immediately, and you're generally going to be using it twice a day for 7 days. We then say go to elderberry tonic and start using it every 4 hours. We then go use one of the mushroom tinctures and use it 3 times a day. We then suggest bump up your vitamin C to 1,000 milligrams and take it 1,000 milligrams every 4 hours. As I said before, vitamin C is water soluble and it will leave the body very quickly. And if you take too high of a dose of vitamin C, your body will tell you you'll get diarrhea. And at that point in time, you stop and you reduce your dosage, but you continue to take vitamin C. Now, we also recommend that adults, in particular, take 1 teaspoon of 500 ppm colloidal silver. Now, colloidal silver has been around a long time, and we used to use it in this country as our antibiotic before penicillin came to the market in the 1940s. Colloidal silver, if it's a high-quality product, and it's only used for short term, because silver ions do not, it's not an essential mineral for our body, so it does not leave very fast, and therefore you need to only take it no more than 14 days. In the case of the flu, probably no more than 5 days, and then allow your body to remove it so you don't have any kind of silver buildup. So we recommend that silver is excellent as an antiviral in this case. Silver also kills all germs by interfering with the oxidation process of the germ. But for this case, excellent for silver. And then finally, depending on your budget, we found a product from Switzerland that is excellent. It's echinacea, and it also has been proven to be a strong immune booster, and it's also antiviral. With that combination of an antiviral drug, Tamiflu, and antiviral and immune boosting natural products, you got a shot to arrest this and hopefully reduce the exposure to you and the family and to our community. The next few weeks and months are going to be challenging for us. News reports will try to be helpful, but they are often confusing and damn right scary. We strongly suggest that you listen to the reports coming from the CDC. I believe in them. And most important, try to remain calm through this. We don't know if this is going to be ugly or whether or not we're going to have something that we are able to use our public health resources to get a handle on. And will there be pockets in the United States that will be worse than others, or will we have a pandemic? But be calm. At this point in time, we just don't know. But do know what you can do to protect you and your family. Soon we're going to have kits to test an individual for the coronavirus. And we will also have other supplies from our states and by our federal government that will be necessary to combat a national public health challenge. And that's just what it is, a national public health challenge. We'll be getting things like masks, but be aware that so far the data is saying that the size of the coronavirus is so small that it can penetrate right through a mask and might not give us much protection. In the weeks to come, we're going to try to keep you up to date the best that we can on this coronavirus challenge here at Wellness RX. The American healthcare system is now going to be tested. Our educational systems are now going to be tested. And our decency on how we treat each other will also be tested. I remain very confident that we will pass the tests. Thank you. And if anything we can do for you at Wellness RX, you just please let us know and give us a call.